The goal tonight really was to introduce you to what we're doing with medical weight loss. I know that there's a lot of information out there, right, in media and on the news, and a lot of it is sensationalized and just not really basic facts. So we wanted to really kind of go over what it is that we're doing, how we think it's different, and why we think it's so effective. We've had really, really great results with the initial rollout. Many patients have already surpassed 20 pounds, even in the first program of 12 weeks. So we're really pleased with how things have been going. People have been feeling well. So we really want to review with you the benefits, how the medication works, what the risks and the side effects are, and how you can get started here at Essential. And I just have to say, I'm really proud of what we put together with Christina. Christina's been instrumental in getting this started and up and running. Being a colorectal specialist also helps too, in that there are some side effects that are internal, and it's a GI thing. It's a DT thing, a down there thing. And having Christina supporting us really helps us, because she has a better understanding, they think, than the average provider in terms of some of these side effects. So that makes me sleep better at night. So thank you. You're the best. This is Christina. She is our amazing nurse practitioner and aesthetic injector here at Essential. She's been with us for nearly 3 years. 3 years. Holy moly. And she, like I said, has really been instrumental in getting this going, and has really been pushing me. She was like, Cal, just order it. Cal, we got to do this. We got to do this. And so she got us started. She started working with some of our very first patients and really developed a protocol, I think, that is safe, fair, effective, and maintains patients' comfort while having them lose the weight.
We haven't had anybody who said, I hate this, I'm not coming back. Right. So basically, semaglutide, you're going to see it like Ozempic, Wegovy, Mounjaro, they're all the same thing, just different brands, the same way you have Botox Cosmetic, Jeuveau, Xeomin, Dysport. So same thing, does all the same stuff. It's a medication that's been around for a very long time for diabetics. So it's originally supposed to lower, or has been proven to lower, people's hemoglobin A1C, which is the diagnostic lab value for a diabetic. And with that, people have lost a lot of weight. It is slow. So the first thing that the medication does is stabilize your blood sugar. So it's great for women who are like PCOS or PCOS-like, struggle with abdominal fat, because it's all from like that spiked insulin. So anybody who goes on a low-carb diet or a ketogenic diet ultimately loses weight, not just because of ketosis, but also because the blood sugar is stable. So it's not spiking from a cookie. So that's the first thing the drug does. And it's a once a week injection. So it's not something that you're taking every day or doing every day. It's just once a week. And then also it slows gastric emptying. That's what it's going to say, like when you read about it. But what that really means is you just digest slower. So you're going to get full sooner. You're going to eat less, right? And then you're fuller a little longer because everything's being processed slower. And so basically that's how it works. It's going to deal with your hunger, deal with that choice to eat less.
Yeah. And I found that patients have really been like less triggered by their, like what they would normally be craving.
Correct.
Like a lot of people say the same thing. They're like, I love sugar, and I don't even think about it anymore, which is huge.
It definitely does something like psychological, where it removes that like preoccupation with when's my next meal or my next snack, or I'm okay having, one bite of something while I'm watching TV versus eating a whole bag of chips.
Right.
So they're studying the drug even with like other addictions like cigarettes and drugs and stuff, because there is a huge psychological thing.
So what other benefits? I mean, there's obviously the weight loss piece, but like how other benefits are there that could be associated with this?
Well, I mean, weight loss can mean, a lot of different things to different people. So I think what the sensationalization of the drug is really from, people haven't had to change their lifestyle or count calories or feel guilty about their bagel for breakfast. And a lot of people have said, I've, waited my whole life to be able to eat a bagel without feeling horrible about it.
Right.
And then still lose weight.
And they're naturally just eating half of the bagel because that's all they need.
Right. So most of our patients, I think, that have been on the program, because we rolled this out in October.
Yep.
Or early November, have really not necessarily gone on a very strict diet, they've just found that they're just intaking less. So with that, weight loss is slow, but it's easy. Right. I don't have one patient who's meal prepping, doing hiring a trainer. That doesn't mean all those things aren't good. It's actually going to help things. But if that's always been a struggle for you, or the planning and stuff like that, this is helpful. Yeah. And I think like through Hollywood, it's sensationalized because of like the lack of hunger. And so for some people, the weight loss is rapid because of that, because they're not really big food eaters anyway. And some of it's vanity pounds. And then for some people, this has been like a really great way to kind of visualize their triggers and things that, you know, they struggle with weight loss.
And our hope was really to help them utilize like better habits. Yeah. So that they're creating, like, this is a tool to help you develop better habits so that you can use this for a sustainable long-term weight loss.
Right. And then when you kind of meet your goal, some people have done a couple different things afterwards. They'll go on a maintenance dose, which is about half of a dose, you know, once a week still, and then wean off of it or stay on their maintenance dose. Other people have stopped cold turkey with the expectation you'll put a couple pounds on as you kind of regulate back to being normal with a bigger appetite. And then some people, I have one person who does a huge dose once a month, and it just kind of slowly dissipates over the course of the 4 weeks. Yeah. So I don't foresee myself doing something like that, because I think you'll feel really sick if you do a big dose, but it does work for some people.
So a lot of people will say, is something I'm going to have to do forever? And in some cases, many people do this for long term.
People who are going through a primary care doctor and endocrinologist for their diabetes essentially have been on it, you know, long term.
But our patients are a little different.
Correct. And if you asked me, what are the long-term side effects of using it for an aesthetic purpose or a vanity purpose more than I'm diabetic? My answer for you is I don't know. It hasn't been studied. So those are the kind of risks that you're taking.
And so let's talk about risks and side effects and stuff, because that's what you just mentioned.
So go ahead.
Yeah. So, I mean, I guess the biggest downside to this.
I think the biggest downside is all the GI side effects. It's not really for the faint of heart, or for if you manifest all your anxiety and have chronic abdominal pain, you are going to be you are going to be miserable. And I'm probably over preparing somebody who's miserable, but
we won't like scare you and then go, oh yeah,
then you hate it.
Yeah.
But it can make you a little bit nauseous. Some people have diarrhea because it's like pushing your body's pushing everything through. Most of my patients are really constipated as they get to a treatment dose. It's not, you don't just start a dose, you have to kind of wean onto it and load it. So the first 2 weeks, some people haven't lost any weight. You're not at a treatment dose, but as you increase the dose, pooping becomes a lot less.
I feel like we've talked about pooping more in the last 3 months than we have ever. Yeah. So, I mean, it's not new for you, but no, it is for us.
And I think, but it's a real thing. Drinking alcohol or edibles will be metabolized much slower. So be mindful of that.
People have been extremely sick from alcohol in particular. So you just need to be really cognizant about your use of it. And it's a physical reminder that.
Yeah. I mean, it's like having a horrible hangover and vomiting. So to be prepared for that.
And just being mindful of that your body's working differently. So drinking more water and just being more intentional about what you're doing to your body.
Or it might mean taking a daily medication like a stool softener.
Miralax, something like that.
So being compliant with something like that.
Absolutely. And I think one of the things that I really like about how we're doing it is that we do the weekly visit, so that there's an accountability there in terms of saying, are you doing the things that are going to help make you feel better, and really working with Christina to make sure that you're not as comfortable as comfortable as you can possibly be. And the other thing I really like, and I think that's different than some other places, is that we're using intentionally lower dosing. It's like slow and steady, so that people are losing weight more consistently, but not like in these alarmingly rapid weights.
We don't want to lose our baby fat.
And it also makes you feel better. That was not even planned. So the GI stuff is very popular. What about like any kind of less popular?
So we just talked about risks, right? So when it was studied pre using it in humans, when it was studied in mice, they found that one or a couple mice developed what we call medullary thyroid tumors, or a thyroid tumor ultimately, in people language. And so anybody who has a history of thyroid cancer or a family history of thyroid medullary tumors, which is something very specific, they're recommending that you don't take it. It's never been seen in a human. It's just been seen in mice.
And is there anybody else that you think are not great candidates for this?
I think that people who really do have a higher BMI and a lot more weight to lose, it's frustrating to wait for that, medical weight loss appointment at a doctor's office or at an endocrinologist, but like you could do it where covered by your insurance. And so I think that, that's probably worth looking into if you were looking to lose 75 pounds,
right? A significant amount.
Yeah, significant. And that's for your benefit. Why pay for it if you don't have to?
Right.
But the downside is that you do have to wait for their appointment because everybody's asking for it.
Right.
Yeah.
Right. Yeah. So our sweet spot, I'd say, is anywhere between like 15 and 30, 40 pounds.
Yeah.
And the less, the easier it seems to be for people. And before you get started with your treatment, we have you meet with Christina and do a full history and physical intake, and to determine your candidacy, make sure she's reviewed lab work to make sure that everything is copacetic so that we can really rule out any major risks and make sure you're as safe as possible.
And we require recent lab work within the past 3 months.
Yes.
And if you need an order for that, you can take the order any lab you want to. I'm happy to give that to you.
Yep. We even have a form you can fill out online and it'll just send it right to you.
Yeah.
So other than that, I mean, I guess like any other medication, there might be some like drug interactions that we need to rule out.
Sure, and that's going to be specific.
And then chronic medical conditions. But other than that, if you are generally healthy.
Correct. And everything we talked about is something that you're willing, let's not say risk, but willing, you're acknowledging, between constipation, etc.
Yeah. I mean, it's kind of like saying like a risk of Botox is a bruise. Like,
correct.
It just happens. And it's not like it's a risk per se, but it's just part of the process.
Part of the process. Yeah.
So, I mean, consistently, we've seen a lot of people with poop problems. So they've been having trouble pooping or nausea. Pooping too much. Yeah, not feeling so good.
I've had one person decrease their dose because the nausea and they weren't feeling very hungry. And it was almost like they weren't eating enough. And didn't like how that felt. So we went down in the dose. And that's all kind of why you come in once a week. A lot of people are kind of giving it to people, here are your 4 injections for the month. I think as I get to know everybody, I start to kind of trust them with taking it home because, scheduling is hard. But committing to this is like obviously a financial commitment and a commitment to yourself and then a commitment to come in once a week.
Right. All of our programs are designed for 12 weeks. And that's really just to kind of have an endpoint so that we can have a time to assess and see how things are going. We'll be finding, because we now have had people who are kind of at that point, they're deciding if they want to restart and do another 12-week program or if they want to kind of wean or adjust their doses and the regularity of them.
Yeah, how frequent. Yeah,
thank frequency. You. And so frequency, that was the word I was looking for. And so we can always just kind of customize that based on your needs. So these are really flexible plans, but the 12 weeks just gives us kind of a guideline to say, okay, let's stop here.
Yeah, and it is that slow. So that first, we've had a couple of people not lose any weight the first week or two.
Yeah,
but then the average is about a pound a week.
Yeah. And then I feel like that time goes by anyways. So you might as well be like working towards something. So let's talk about cost. It's pretty straightforward. We do the 12-week program. It's the consultation and the history and physical, not the lab work, but the time with Christina is included in that first visit. And then there's 12 treatments that can be done at the first consultation if she approves your candidacy at that time when you book the next time. And that's for $1,500 or $500 a month. And then from there, we have dosing payments for people who are kind of weaning and getting into the maintenance
which we can kind of individualize. We can talk about it when we're
absolutely
there.
It's really based on like how much you're using and how often you're coming. Well, thank you so much for coming, and we hope to see you very soon and start your weight loss journey with us. Bye.